Welcome to Master Health Center's podcast, where we discuss all things Chinese medicine and Chinese martial arts. Our goal is to help you achieve better health and wellness. We hope you enjoy today's episode. Well, welcome everyone to Master Health Center's weekly or monthly podcast, actually. Monthly podcast on all things Chinese medicine and Chinese martial arts and healthy living. Today we have Kevin with us and we have Andy with us.
Hello.
So you want to say hi?
Hello, everyone. How's it going?
So today's topic, we're going to discuss on low back pain. Low back pain is actually one of the most common problems in the world, or at least in the U.S., according to research. The most common reason why people will go see like a physician is because of back pain and happening in the low back. And so we just like to discuss on, like the reasons of low back pain, why there is low back pain, types of low back pain, and different treatment modalities and ways we can treat according to Chinese medicine and how Chinese medicine and acupuncture is effective for low back pain. Do you want to start, Andy, with your experience with low back pain and your thoughts?
Yes. So definitely over the last couple of years, back pain, low back pain has been one of the things I've treated the most with people. And I think you said it earlier in the U.S., I think it's like you said, something around 39%. 39%, right? Interesting statistic. They have back pain. So it's like Master Tyehao said, all over the nation, probably all over the world, And the reason why, because low back pain is caused by different reasons. It could be more than one reason. Of course, the most common one is a fall, right?
Yeah.
A fall or a direct injury to the area can
traumatic injury type.
Yeah, exactly. Can cause low back pain. But there's other things that can cause low back pain as well, like Western terminology, right? If we think about catching a cold, sometimes when people catch a cold, they develop back pain along right above like their hip bones, going across their low back. Another etiology for low back pain can be from digestive issues. People with chronic large intestine issues, IBS, they usually have some sort of low back pain associated with that as well.
Yeah.
Then we have other injuries as well.
Just like traumatic injuries, we talked about falls. We talked about people just moving wrong or twisted wrong. I treat a lot of people, that, especially in the wintertime, they shoveling snow. You've seen that?
Oh, yeah,
Kevin?
we've seen that a lot.
They shoveling snow and they're like, oh, I'm shoveling snow. My back,
right.
Like that. And so then they'll have the low back pain. A lot of the other things that will happen with low back pain is people's, just their lifestyle, which will cause degenerative disc disease,
right.
The lumbar, maybe arthritis will cause the low back pain. And so just over time, as they get older,
so arthritis,
the
DJD.
bones, the bones will start to deform a little bit, and that will cause low back pain. The other reasons why people will get low back pain is they're not exercising.
Oh, yeah.
So their muscles, especially like the abdominal muscles, it influences the low back pain,
right.
the back muscles themselves.
There's an interesting thing about that too. That through my research of traditional Chinese medicine, what have I encountered? Some people, when they come in for treatments of low back pain, sometimes it is a good idea to go directly. But then we were talking earlier about going distal. And this is one of my favorite distal points to treating low back pain. Usually, I'll insert a needle in the abdomen, around the middle of the abdomen, or like slightly below the umbilicus, your belly button. And that will help relieve back pain too.
Yeah.
The theory, I believe, on this is that the Chinese, right, the ancient Chinese, they found a connection with the connective tissue that's connected to the spine. It's the mesenteries, I believe is called in English, in Western terminology. But the mesenteries, they're made out of some sort of oil, like a yellow substance, right? I think I've asked you this many times. The word for in Chinese for yellow, it's
Huang.
Huan, right?
Mhm.
Huang. I may be wrong about that one, but the connection is that there's a connective tissue that attaches to your spine, and that same connective tissue also wraps around your organs in the inside, all the way into the front of your body. So by influencing that connective tissue in the front of the body, you can influence its insertion in the back part.
Fascinating.
Yeah,
That's very interesting because so the channels in Chinese medicine are the spaces that are all wrapped around with the connective tissue, with the vessels and stuff.
okay,
And so the channels are part of the connective tissue itself as well.
right.
And what's interesting too is in Chinese medicine, there's we call mirroring. And so when you're treating the front here using the acupuncture, you're also treating the back at the same time. Or like if you're treating the elbow, it's also treating like the opposite side knee. And so, and then those in Chinese we say 对应, that's like the mirroring aspects. And so things that look the similar mirror image of everything. So like you treating the front will help treat that area in the back. And so,
Interesting.
yeah, it's very interesting
Mhm.
to think about.
And I like that approach sometimes. So that's a good distal approach, right?
Yeah.
What we talked about earlier.
Yeah.
Distal meaning using points away from the site of pain to
Mhm.
try to get rid of it, right? And I like that approach a lot with someone who has digestive issues, like around the belly.
To help
So,
on
like,
that.
yeah, trying to pinpoint where the back pain is coming from, and trying to treat that root cause of it. But we were also talking about that treating it, the back pain directly is also very effective as well.
Yeah,
Yeah.
yeah.
Yeah, through my experience, where treating distal points have been beneficial, like I almost always go direct to, and I get really good results in
Yeah.
reducing low back pain.
Yeah,
Yeah.
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 What have your experiences been as getting treated, Kevin, with low back pain and your feelings and things you've seen and
I
felt?
think the biggest one that I've had was when my roommate had invited me to uh, go into water aerobics. And I did the first time. I was like, okay, this is going to be water. I can push myself as much as I can, and I don't have to worry about getting burned out. Well, the next day, I was practicing the qigong form that I was practicing when I first started there, and I was in so much pain that I was actually crying. And you took me back. And while I know this isn't true, but it felt this way. To this day, I'll swear you lit one of those on fire and had it red hot, and you stuck it in me. And all of a sudden, I felt it hurt when you put the needle in, but the pain just went away after that. And I think that to me, that was one of the greatest signs that acupuncture actually works, is because as soon as you put that needle in and the pain started going away, I was like, this stuff is good. But you've been treating me for a while whenever my back starts acting up, and I'd say 9 out of 10 times when I get done with the treatment, I'm ready to go and conquer the world, or at least do some paperwork.
Yeah.
What are some of your experiences from working at Master's Health Center on the front desk, seeing patients coming out, and
I
how
think
they feel after their back pain and
I
stuff?
think the one that I like the most is there was one Andy was treating. She came in, her back was really sore. You could tell by just walking. You could always tell when people have back pain by just how they walk.
Yeah, if they're walking different. That's real.
And she came in, she was slow, and when she came out, she was reaching in her bag, and all of a sudden you see the light went off in her head, light bulb, and she's like, "Wait a second, my back's not hurting." I mean, it could be that quick, but we got help. I tell people that one treatment won't resolve the issue completely. You may feel good, but it will come back. You need to have multiple visits, and that's something that we see a lot of is people think, okay, well, one treatment and I feel good, that's it. No, that's not it.
Yeah.
I mean, I still get treatments every once in a while for my back, and I know the main reason is because I have a weak core and I have a big belly, and those are things I need to work on to help strengthen my back. And acupuncture does an amazing job in helping.
Yeah, definitely. If you don't do some changes in your life, the chances of your back pain returning is pretty high. Like if you exercise regularly, and I'm all about exercise, because if you have the belief that if you have low back pain and you're just gonna stay still and wait for it to go away, chances are it's very high that the pain's just gonna get more intense. Being still and sitting for a long time is just gonna make the pain worse. Like you need that circulation. Your body, your joints, they were made to move, right?
Yeah.
So when you move around, when you move those joints, you're bringing circulation to that area. And the same way, like we're kind of doing the same thing by putting needles in the area, especially if it's tight. That may be why you felt like some sort of pain when he put the needle in. The tighter the area, maybe like that's what caused the pain. But when we put the needle into a certain spot, we're increasing circulation to that area.
Yes.
That will probably be too hard. Like if you're in a lot of pain, I definitely understand why people have a hard time moving, have a hard time exercising, because it's just gonna make the pain worse.
Yeah.
And that's where we come in. We help relieve that pain,
Yeah.
so then they can start doing the exercises like Tai Chi or stretching or of their hips in order to reduce that tension.
Yeah, the Tai Chi is very good
Very
for the
good.
low back pain.
Right.
We have students that practice Tai Chi and they just continue because it helps them with their low back pain and any other joint pains that they
Yes.
may have as well.
Yes.
And if the pain comes up a little bit more, then they'll get acupuncture and then they'll continue with the Tai Chi.
Mm.
Because the acupuncture will, like what you were saying, will improve that blood flow to stimulate your body self-healing mechanisms, allow the body to self-heal.
Yeah, I remember when I started, one of the lessons that you and your dad both drilled into me was listen to my body, and that's what we tell all the new students because they'll come in like they have a bad back, and I says listen to your body because your body knows you better. If you know you can't do something, you see someone else doing, don't try it because you can get injured if you push yourself too much.
Yeah,
Yeah.
definitely. Like we all have that capability of pushing past the pain. Everybody does, really, and you'll see it a lot. Like a lot of people will come in here and like they're just so used to pain that they'll even tell you like it hurts, but I'm used to it.
Yeah,
you know?
yeah.
We can push
happens.
past it. Like you can run. You can even be in a lot of pain and run through it. It doesn't mean that it's gonna help your body though.
Yeah.
Yeah.
The chances are it's gonna make things a little worse.
Mm-hmm.
A good example of this is there's a world famous bodybuilder. I think his name is Ronnie Coleman, right? Won a whole bunch of awards, right? Loves to bodybuild. It's his thing. He loves it, right? He's had several surgeries along his spine and fixations. He has screws and fixations along the spine because all the heavy weights over time it degenerated his spine. Now he can push past the pain and continue to lift weights, but his spine's already, that's it. He already has rods. He already has screws in his spine. It doesn't mean he doesn't have the pain anymore. It reduced maybe some because now he doesn't have a lot of motion from his degenerated spine, but he's still in pain. You know, you can push past it, and it doesn't mean that it's good for your body. Is what I'm
Yeah.
trying to say.
Yeah.
So you kind of need to do these things in order to take care of your body,
Yeah.
like
So
stretching.
that brings up the question, of the different types of low back pain, though, because you can have pain that is just muscular
Muscular pain.
within the muscles itself, whether it's a muscular strain or whether that type of muscular, you pulled it, maybe you bent wrong or something,
like QL
pulls the
muscles.
muscle.
Yeah.
It pulls the muscle. But then also you have problems with the vertebra.
Yeah.
You can have where the vertebra is collapsing or slipping, and then that causes herniations or bulging discs, and that will push on the nerves. And so when you have the pressure on the nerves, then you'll get the sciatica type pain, pain running down the legs.
That's right.
And
I think that's actually the most common that we see is
the sciatica.
with people with sciatica.
Yeah. And the sciatica, you can have pain that radiates behind the leg or on the side of the leg, or pain that comes up into the front of the leg. And also with sciatica type pain, though, too, a lot of times it happens in the lower lumbar, but sometimes you can get it from like the piriformis muscle. The piriformis can actually push onto the nerve, and that will cause pain radiating down into the legs as well.
Yeah. Through my experience, I see a lot of low back pains coming from ankle injuries, knee injuries, hip injuries.
So postures.
Right. It's like a structural imbalance.
Structural.
So there's something going on with your joints that's throwing off the structure all the way to your low back, even up to your neck a lot of times too.
Yeah.
So I'll get a lot of patients with a lot of hip pain. And more often than not, when I get rid of that hip pain that's also coming to the low back, it's coming from the low back, they'll feel that side loosen up, but then they'll feel the other side tighten up.
Yeah.
So it shows you how your hips play a big part into low back pain as well.
Yeah,
Knees,
definitely.
ankles. Yeah.
Definitely. And some of the root causes of low back pain in Chinese medicine. So in Chinese medicine, it is said that the kidney houses the low back. And so when we look at the kidney channel, that is one of the things that we can treat the root cause of that low back pain.
Yeah.
And then sometimes people's pain will they'll have pain when the weather changes, when it gets cold or raining. And so that's a different reason why. And so we can use different herbals, you can use different points or different methods like moxibustion, things like that to help with the pain. There's also damp heat. We call dampness in the heat. And that is characterized like if people will have, we'll look at their tongue, it'll be like maybe red, greasy, yellowish type tongue. Their pulse is rapid, slippery, and they're having the low back pain, and maybe they eat a lot of greasy food or drink alcohol or something like that, and that causes heat inside their body, and the dampness that will obstruct the blood from flowing, and that will also cause pain. And then the kidney deficiency, as people get older, the kidneys are also related to the bones. And so, that's where like you can have the vertebra problems and the slip discs or the herniations and stuff like that. And we can treat, the root cause of it as, treating the kidney channel, nourishing the kidney, using the herbals, using the acupuncture, exercise to help those type of pain.
Yeah.
You were talking about like the viruses and like colds, like people getting cold and stuff.
Cold. Yeah.
There were years ago, somehow I got a different virus, or it was like a flu or something, and it was causing the low back pain. And I was telling my father, And he said, okay. And he put me on the table. First needle he put in, and I relieved it straight out.
Very cool.
And I didn't have any pain at all after that. And so, that type of thing can also, cause that low back.
So that was your experience with low back pain.
Mm.
So you see one needle, and it helped you out.
Yeah.
Of course, not everybody's the same.
Yeah. Everyone's different.
Yeah. It depends on what's going on with your body. I'll use myself as an example. 1 year ago, I'm playing football, soccer, football,
Yeah,
right? You remember this? And so nobody knows this, but like I have a huge rod going down my right leg from a motorcycle accident. It's a fixation. It goes all the way down to my ankle, down to my foot, right? So that throws off my hips, throws off my low back. I use acupuncture to treat it. I used to run, but what I've noticed, even after the injury, when I would run, it would throw off my hip, it would throw off my back, and I would repeat acupuncture to help get rid of the pain. So I was very eager last year, and I tried football and I tried soccer. And it's been a very, very, very long time since I played, and it was a tournament too. It wasn't just a regular fun outside soccer game. It was a soccer tournament. So I told my teammates, "Hey, listen, I got a big fixation on my leg. I can't do the running, and I won't be much help for you guys." So they made me goalie, and man, it was intense. Because it's a tournament, people want to win. So man, they were kicking that ball hard. They were aiming for my head, and it's been a while since I played, but I'm also competitive, and I was giving it my all. I think the whole game lasted about 1 hour. That was it. But afterwards, I can barely walk. I couldn't really sit down.
Oh,
I couldn't bend. The whole right side of my back, even my left side, was in a lot of pain. So immediately when I got home, I did acupuncture on myself, and it reduced the pain, but enough to go to sleep, but it was still there. When I woke up the next day, I still had the pain. It was intense, as if everything happened again. The left side was in a lot of pain. The right side was in a lot of pain. Couldn't bend, couldn't sit down. So I started doing acupuncture on myself. And it took about, I think it was off that day. It was a Sunday. So it took just about all day because I'm doing it with one hand and it's on my back,
Yeah.
So every time I did acupuncture on myself, I felt a little bit better. First, I felt the tension reduced a bit. Then the second time I did it, I felt, I can bend a little bit more now, and the tension reduced. Took a little break, went back at it, then did it again. And then I realized I can bend, I can sit, the pain's reduced, the spasms reduced, still got a little bit. Maybe I did it about 2 more times, and by the end of the night, I was walking normal. I was sitting down as if nothing happened. I got rid of the pain on the left and right side of my body. I went to work the next day, and this other job that I have requires picking up people as if nothing happened. I went from just a few hours before that incident, barely able to walk, barely able to sit down or even bend. The next morning, I was working as if nothing happened. I used acupuncture to help relieve my pain, and I don't know a lot of modalities that can say the same thing.
Yeah.
Yeah, you definitely can't do much chiropractic for your back when you.
If they're spasmed. If they're the first thing they're gonna do, they're gonna try to reduce the spasm before manipulating the vertebrae on your back with chiropractors. So even if you do want to see a chiropractor, which you probably need it, I would see maybe an acupuncturist first to reduce the spasms of your low back, so the chiropractic treatment could be more effective.
Yeah, yeah, definitely. That brings up another thing with integrated medicine, integrating the acupuncture and the Chinese medicine with other like Western medicine and stuff. One of the things that I see is a lot of people are taking so many medications for their pain problems, low back pain, whatever. Yeah. They're doing injections and steroid injections and stuff. And the acupuncture, because of the natural ability of healing your body and stuff, can help you to to reduce on those medications.
Yeah.
To reduce it or even get rid of it.
Yeah, I know.
That you don't need to have all those medications and the side effects from those.
Yeah, I know
Sleepy, drowsy, all that stuff.
I know we've had several patients that's had injections for their back pain, and they say that it only lasts a little bit. And some people say just a couple hours, some say like a day or so, and then their pain is back. And
Because of masks.
yeah, and then they come in, they remember. A lot of our patients are returned, especially the back pain ones. They remember where they went last time to help get their back feeling better.
Yeah.
And they give us a call, and we're like 5-10 treatments, and they're back to normal.
Yeah. Using that. And that's where, even the cost effectiveness of using acupuncture
Yes.
is very good because so many people spend so much money on other like the medications and surgery and all sorts of things that just cost a lot of money with the healthcare. But the cost effectiveness of low back pain is it's very effective.
Right, by
And-
having an acupuncture, right?
Yeah.
Regularly, you can save a lot.
Yeah, and I
No
think
surgery.
I think that's why in the recent years, according to like the physicians, like their standard of care, it's been noted that the first line of care for especially low back pain, first line of care would be things like acupuncture, and they mention acupuncture
Mm-hmm.
doing like the first line of care. And I think it's because of the cost effectiveness and how acupuncture will help with your body to heal itself and the effectiveness of that. In recent years, Medicare will cover chronic low back pain
Only.
and
Yeah.
only
They
And-
only cover chronic low.
chronic low back pain. And the reason that because of that is because they've seen the effectiveness of it, like the Western medical model. But that's a whole nother story of like how, where it would actually cover. Even though Medicare covers, you have to have a physician supervise.
Yeah.
And you have to be in a physician's
Yes.
office and
Yeah, it's
stuff like
kinda
that.
Yeah.
ridiculous.
Yeah. So
That's a different topic for this.
yeah, that's a whole different topic.
That's a different can of worms.
Yeah.
Kevin did mention something earlier, and I want to try to add a little bit of clarification for those patients that return, who have back pain and they return. I would say the prognosis for everyone is different.
Mm-hmm.
If you're a younger person and you don't have a lot of injuries, you tweak your low back pain, prognosis is pretty good. You probably need 1 or 2 sessions, and then you're good to go. That population of patients that return that Kevin was talking about, usually they're more severe. They have some sort of like fixation, like rods or screws in their low back, and so the pain's gonna be chronic. We have helped a lot of people reduce their pain even with screws. Yes, it's gonna come back. You're gonna do things throughout the day that can aggravate the area, and you have rods and screws already, right? So, but they keep returning because there's no medication involved with acupuncture. Literally, it's your own body like healing itself almost in a way and reducing the pain. So there's no extra medication being put in by us. It's just we know where to put the needles to create a certain effect. Yep. And the people with these fixations, with these screws, they return because, the pain, it would return, but usually they can go for a good week, and maybe 2 weeks, 3 weeks before the pain returns.
Yeah.
So like as long as you have something in there, like in your body that's causing the pain, you can expect it to come back. But wow, you get a big relief of symptoms with acupuncture over just taking muscle relaxers, that makes you dizzy. And it goes on for a while. I would say, I'm sorry, I'll let you
Sorry,
speak.
no.
The one patient population that is very difficult for low back pain, with my hardest, was someone who has like already advanced liver cirrhosis. Like he would tell me that the pain will go away for maybe a day, maybe a few hours, but then it'll return. And I want to do more for him. But with liver cirrhosis, and the liver's already swollen, you see there's an underlying cause for that low back pain, which like I can put a needle there directly and you'll feel good for a little bit, but like that main cause of like your liver being swollen, it is quite difficult, like very difficult. You will get some relief with low back pain after acupuncture. Like chances of it returning are pretty high.
Yeah.
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 Yeah. And
It's
to
pretty advanced disease.
and to add to that, I shouldn't have been so how I stated it,
Yeah, you're good.
because people, when their back starts feeling better, they start going back to the normal activities they used to do.
Yeah.
And
Yes.
when you're healing, sometimes you have to restrict yourself. You have to watch yourself. It's like what I said with Tai Chi is listen to your body.
Mm.
And there was one guy, Ty had been helping with his back, and he had been gone for maybe a month or so. And he went and mowed his lawn because he felt a lot better.
That's good for him.
Yeah. But unfortunately, his body wasn't ready for that.
Not ready yet.
And he came back in, and when he walked in, you could tell he was in a lot of pain. And so when getting treatments, even with acupuncture, you need to be careful on thinking just because you're feeling better, you're able to do everything you were able to before the injury.
Right. So he kind of re-injured the area.
Mm-hmm.
And that's where I love the beauty of Master Lu's, because we don't just do acupuncture, we also teach Tai Chi. So a lot of people who have like weakness of their abdomen or some sort of structural imbalance with their hips that's causing the pain to come back, acupuncture is great in reducing the pain. It really is, right? But then you got to address what's causing the pain, whether it's from a weakness of the abdomen or even tight muscles. You still got to stretch it. You still got to move it. And that's what I loved about Tai Chi, because you're moving all your joints of your hips, your knees, your ankles, your low spine, your upper back, your arms, your neck. You're moving all those joints in a non-impactful manner where it won't hurt you if you do it for 20 years. It's not like lifting weights where it's going to degrade your joints. No, it's enough weight from your own body that it'll give you some sort of resistance, right? But you're also getting circulation to these joints, into these areas as well.
And that brings up the other question. Sometimes there are times where people's pain hasn't changed. And so we'll be treating, 5, 10 treatments, and they just haven't really had changes yet. And so at that time, it's not the acupuncture's fault or anything like that, because the acupuncture, the Chinese medicine works. It will work. But there's a different underlying thing,
What's the underlying cause?
like cancer, or like, some type of bone disease happening, something that's a little bit more deeper.
Yeah.
I have had patients with cancer that they would have severe pain, tumors along the spine. And I remember a patient with that having the tumors. The acupuncture will help just to manage it, but her pain was always there because of those tumors along the spine. And because she has those tumors, that's a whole different way of treatment. Like we have to treat the cancer, not just only doing the
Would you choose more immune points for that?
So I would do a little bit different way of treatment with, you help with the pain, but we can't really say, oh, I'm treating cancer, but we help support that type of treatment. If they're doing other treatments, whether it's chemo and radiation or if they have to do different cancer treatments, then we will support that. And then use different points to help build the immune system, build the energy, help so the cancer can be, more controlled and not as bad and stuff. And then using the herbs will be effective. There's Chinese herbs that will help with arthritis, arthritic pain, arthritic low back pain. When the weather gets bad, you're feeling more. There's Chinese herbs that will help with the traumatic injury type. You just pulled your back. Herbs that will help move the blood and move the qi, and that will help heal the body. Herbs that will get rid of those, like I talked about, the damp heat. That's a internal pathogen that blocks the channels that will help get rid of that and open up the channels so the blood can flow better. And so using the herbals and then just simple exercise, you can do these type of exercise just straight up like this, help with your low back, and then go to the side. You can sit in the chair and that will help with your low back. Just very simple. If you can't stand, you just come up. You do this type of exercise. 3 times in the front, 3 times on the side, 3 times on the side. And that will help stretch these muscles, help with the low back. This day and age, everyone's at a computer sitting down.
Yeah.
Posture could be bad, and that will cause the low back to have, be sore a little bit. But doing those type of things, the movement also.
So we touched on that's a physical exercise right there. We touched on acupuncture, on herbs in order to get rid of back pain. One thing that we also do to help get rid of back pain that we do a lot in Master Lu is cupping. Because Chui Na is one of our massage. It's also one of the branches of traditional Chinese medicine. Well, I don't do massage or Chui Na. I do add cupping because it has the same benefits of massage. So I always explain to my patients how does it work compared to massage therapy. Same benefits, more oxygen to the area, more circulation to the area, right? Loosens up the area. Just different way of approaching it. Whereas massage, I would tell people like we're adding positive pressure. Like if I can use Kevin as an example, like I'm pushing down on his skin, right? Right. Well, this is like the massage example. The cupping works differently. The cup works differently. So there's another layer of skin underneath the superficial top, right? Underneath, below this superficial layer of skin, there's another layer of skin. So the idea is that the cup, when we put it in the skin, creates a suction separating those 2 layers so that circulation can increase to the area that has been tight for a while. So that's more like negative pressure. So massage, more positive pressure, like I'm digging into your skin, and cupping, more negative pressure, where I'm separating the upper layer of skin from the bottom of layer of skin so that blood can flow where it's been tight for a long time. Because that tightness will definitely aggravate low back.
The cupping is very effective for the low back pain and
for neck pain.
Neck pain. All those large muscle type pains help loosen help with the blood flow, help with the muscles. Even with like herniations, you can use the cupping. The other one that's very good too is using moxibustion on the low back. We don't have this in our clinic, but in China, you'll see a lot of, and in Taiwan, you'll see moxa boxes. And so people that don't know what moxibustion is, it's a Chinese herb, and it's called mugwort, and we will burn it. And the function of mugwort, of moxa, is it heats the channel, and it increases the blood flow in the channels. So it warms the channels. And so one of the things they have is a moxa box, and there's pole moxa, so moxa sticks. They're usually, about 6 inches, maybe 12 inches long, and we burn it. And they would use a moxa box, so they'll burn several sticks, put it inside the box, and then they would put the box on the low back and just let it burn. And that is very effective. And you can move that box along anywhere along the thing, along the back or larger muscles and stuff. And that's very effective to help move the blood and the circulation and warming the channel. So a lot of times you would use the moxa, especially like cold conditions. If they're, if they're having low back pain due to rainy, cold weather and stuff, then the moxa is very effective too. So, all right. Any other thoughts, Kevin, about low back pain? And
I think even when you're getting treated, doesn't matter how, with acupuncture, you got to be careful because you're not at a place where you can do the things you used to. You got to be careful because you re-injure it. It's going to take longer even for acupuncture. It takes longer for you to finally get to the point where you used to be.
Right. So exactly, you gotta be careful. So if the back pain is coming from weakness, then definitely physical exercise is what you need to do to approach it. If your back pain is coming from being sick, having a flu, definitely taking care of that. Your body, making sure you're getting vitamin C, the right supplements would be beneficial.
Yep. Well, thank you very much. And
Thank you.
Discussing low back pain. And for those that are listening, if you have low back pain, feel free to give us a call at Masters Health Center. I think we can help you to feel better, help you to improve your movement, help to relieve that pain, whether it's sciatica type, if you had surgeries, just muscular, traumatic injury. If you call us, schedule an appointment, we can help you using the acupuncture and Chinese medicine to help relieve your low back pain. Thank you very much.
Thank you, everyone.
Thank you.
Talk to you next time.
Bye-bye.
All right, see ya.
Thank you for joining us. We hope you enjoyed today's episode. Please like and subscribe to the podcast and YouTube channel. We'll see you next time.